to another episode of Bula Wellness on FBC TV. Thank you for joining us today. I trust that you have been enjoying the program so far. I also hope that you will be learning a lot from everything being shared on the show. Today, we will be discussing an issue which has been one of the many contributors to the growing NCD rates in Fiji. That is, substance abuse. However, on today's show, we will be discussing Kava abuse. Kava, Piper mesthicum, has been used as a ceremonial drink in the Pacific Islands for hundreds of years. In recent times, the use of Kava has grown from traditional use to a more social use, bordering on abuse in some quarters in Fiji. The local vernacular evening talkback shows is testimony by people sitting around in their homes and consuming brown label, a local term for kava. Likewise, the consumption by Fijians of Indian ancestry now supersedes that of the Itoke population group. Many of the hardened consumers of kava sit in late into the early hours on a regular basis. The sedentary periods and the often associated cigarette consumption, both active and passive, prove a lethal mix. Unusual snacks and abnormal dietary times all contribute to non-communicable diseases and communicable diseases. In ceremonial use, the numbing effects on the tongue and the relaxation brought about by kava are mild in nature. It is reported that its effects are similar to alcohol, but the notoriety of excess alcohol is not present with kava use. We all are aware of the preparation of roots and or stem are chewed or ground into pulp and added to cold water. The resulting thick brew, which has been compared to the social equivalent of wine in France, is offered to guests and dignitaries visiting the Pacific Islands. In addition to its ceremonial use, kava is best known for its relaxing qualities. Kava is said to elevate the mood, well-being, contentment, and produce a feeling of relaxation. Several studies have found that kava may be useful in the treatment of anxiety, insomnia, and related nervous disorders. International research remains inconclusive, however. There is serious concern that kava may cause liver damage. More than 30 cases of liver damage have been reported in Europe. However, researchers have not been able to confirm that kava is toxic to the liver. It's not clear whether kava itself causes liver damage or whether taking kava in combination with other drugs or herbs is responsible. It is also not clear whether kava is dangerous at previously recommended doses or only at high doses. Some countries have taken kava off the market. It remains available in the United States, but Food and Drug Administration issued a consumer advisory way back in March 2002 regarding the rare but potential risk of liver failure associated with kava-containing products. It is impossible to say what, if any, dose of kava might be safe. Kava may cause liver damage. Interesting evidence suggests that kava may be helpful for the following health problems. Retired Professor Suthi Swaran, a well-known and respected chemistry researcher, formerly at USP, related that the chemical method of extraction of kava in Europe was responsible for the liver toxicity. That the Pacific way of pounding the kava and the aqueous extraction of the active ingredient did not demonstrate liver toxicity. These studies of recent assisted in the European bans being relaxed. Now, looking back at Kava and its use in anxiety, a number of clinical studies, though not all, have found Kava to be effective in treating symptoms associated with anxiety. Reviewing 7 scientific studies, researchers concluded that a standardized Kava extract was significantly more effective than placebo in treating anxiety. Another study found that Kava substantially improved symptoms after only 1 week of treatment. Other studies show that Kava may be as effective as some prescription anti-anxiety medication. According to one, Kava and diazepam or Valium cause similar effects in brain wave activity, suggesting that it may work in a similar way to calm the mind. Research on using Kava for anxiety has decreased because of the reports of liver damage. A 2004 study found that 300 milligrams of Kava may improve mood and cognition. That it is significant because some prescription drugs used to treat anxiety, such as benzodiazepine, including Valium and alprazolam, tend to decrease cognitive function. Kava in insomnia. Similar evidence suggests that Kava may help improve sleep quality and decrease the amount of time needed to fall asleep. Due to concerns about Kava's safety and the fact that other herbals can treat sleeplessness, Kava is not the best choice for treating insomnia. We note that there are distinct advantages of Kava consumption in traditional ceremonies and possibly in a social setting too. However, the science behind Kava does demonstrate that excessive use is not healthy at all. There are other agents who can act in a lot more effective manner for anxiety and insomnia. We are quite privileged to have Dr. Ismaili Tukana with us today to discuss this important issue on Kava abuse. Welcome, Dr. Tukana.
Bula, sir.
To start things off, how bad is Kava abuse today compared to maybe 10 years ago?
It's the fact that I've heard that Kava not being able to supply the national need is testament that Kava is more abused today than 20 years ago. We cannot supply our internal needs of Kava. That to me is evidence that Kava is more abused now than before.
That is indeed really bad, Dr. Tukana. Thank you for that insight. Stay with us. More coming up right after this. Welcome back to Bula Wellness on FBC TV. We have Dr. Ismaili Tukana with us today, and we are discussing Kava abuse. Dr. Tukana, kindly describe the plant Pipa mesticum.
Thank you, sir. Pipa mesticum is a herb. We call it Yangona in Fiji. Some places in Fiji call it a kona. Hawaii calls it awa, I think, and the Australian Aborigines call it the grog. Those are the kind of names it's planted, and it's planted for traditional purposes. It's planted for social purposes and also for spiritual purposes in some quarters of the community.
Okay. How long does it take to mature?
Well, in some provinces in Fiji, they talk about 3 years, but as a normal rule, it takes about 4 to 5 years to mature.
Now, what are the active ingredients of Kava?
There is a chemical in the Kava that's called Kavalacto, which is the active ingredient in the Kava that causes the the type of things they've been talking about. It reduces your stress, it makes you sleep better, and those other effects of the kava, it slows you down. Those are some of the effects that is associated with kava lactum.
It's interesting. What are the available forms of kava?
Kava, in the Fijian context, sometimes we call it the waka, that's the root of the kava. And the other part is the lewena, which is the stem of the kava. Those are the two, and it can be done in liquid form. I think I've come across a situation in Fiji where it's made into kava tea. In one of the hotels, I saw it being sold there.
Yes, that's technology and advancement in commercialism. Now we're getting kava tea bags and covered, in a can. Apart from the traditional, powdered kava from the roots and from the stem. How is kava prepared, and are there health risks to this process, like hygiene or sanitation?
Yes, kava once matured or ready for use is first of all cleaned thoroughly so that all the soil and things are done properly. And they are separated. Usually the roots is separated from the stem, and then after that is dried to make it very dry, the roots and the stems. In the preparation, usually it's first pounded into a powdered form. So you either have the lewena or the waka, which is the root, or the stem. The mixing part is the risky part, where we really need, that's where the hygiene part comes. You really need clean hands to start mixing the yangona. If not, it is a possible source of transmission of diseases, like typhoid. For example, in the region where I come from. It's very important that you wash your hands in the preparation. So from the uproot to the preparation, to the drying, to the pounding, to the mixing, there needs to be, hygiene needs to be practiced.
What about the water?
And the water needs to be cleansed. Yeah.
Should children consume kava?
Children and kava. Well, if they are consuming carbonated drinks now, I prefer that they consume kava. It's more organic than the carbonated processed drinks that's full of salt and sugar. And all those stuff. But it really depends. Is it a traditional, or is it a social drink, or is it a spiritual? Those are the three areas where kava is usually used in the Fijian context. So the question of children using it, it really depends. Is it for the traditional use, the social use, or a spiritual or healing perspective?
Makes sense. If you're using it for the traditional or the spiritual. But the way some young people are using it, they are basically misusing it on a social platform.
Exactly.
Okay. Should kava consumption be an informed choice? The social consumption of kava be an informed choice?
I think so, sir. In the context of NCD, informed choice is, at the end of the day, people have to make informed choice on whether they should take kava or not. So yes, my answer to that question, people should be left to make an informed choice. But the critical thing in kava and alcohol and substance abuse is drink in moderation. That is the message. You need to make an informed choice, but use things in moderation.
Should our local health authorities have a regulatory role in kava consumption, as there are public health implications?
That has definitely occurred, where we've had experiences of a typhoid outbreak in Fiji. The public health authorities have managed to come in, especially in the consumption of kava, and had rules about the mixing of kava using clean water, hygiene in the mixing of kava.
What about food handlers or handlers of kava? Is there some way that they might be, spreading disease whilst they're preparing the product for marketing? Should we be doing any special tests or screening?
I would think, as a general rule, yes, they need to be cleaning, but the hygiene, the preparation of kava for drinking is more a risk part than the preparation for selling of the product.
One concern we've mentioned about fizzy drinks and versus the occasional or ceremonial use of kava. Now, when we look at the social context where people are sitting around and drinking yangona and consuming chaser, what are your thoughts?
Yes, the association of kava with non-communicable diseases in the 2002 and 2011 national study have shown that the association between kava and NCDs is the chaser. Worldwide, as we try to reduce non-communicable disease in the country, there are 6 lifestyles that we are trying to reduce. And when you look at the chasers in kava, they consume this. Number 1 is tobacco. Number 2 is alcohol. We do our wash down. And number 3, we sit for long. We are not physically active. And then we eat a lot of salt, sugar, and fatty chasers. Yes. Those are the 6 modifiable that is now linked to, if you look at all the chasers that Fijians are eating, it contains those 6 lifestyle risks. That's the association that we are having in Fiji. We are drinking too much kava and the chasers is making it worse, which is associated with non-communicable disease.
I think you've rounded it up very well. Would you like to give a final message to our viewers?
I think the message in kava, or substance abuse for that matter, remains that it's an informed choice. As whether you are drinking kava traditionally, socially, or as a healing process in the spiritual sense. But you need to drink in moderation. And when you are drinking kava, the Fijian evidence shows that it is the tobacco, the alcohol, the wash down, and the sitting for long, and also the eating of fatty, sugary, and salty snacks that is contributing to the NCD. So the message for Fiji is choose to drink kava if you want to, but drink in moderation and watch your
Thank you very much for that very educational and very interesting discussion. I guess if there was something that we have all learned today, that it's either we control the kava or else kava will control us. Thank you again, Dr. Tukana. Don't go away. More coming up right after this. Welcome back to Bula Wellness on FBC TV. Earlier, we had Dr. Ismaili Tukana as a guest, and the hot topic of today is kava abuse. Now, please listen carefully and take note of take-home messages we have for you tonight. Stay away from excessive social consumption. The seeds of NCDs are laid with long sedentary periods, associated cigarette smoking, and eating of odd chasers are not conducive to healthy lifestyles. Obesity and diabetes follow closely to such habits, especially with genetic predisposition. Communicable diseases like gastroenteritis, dengue, leptospirosis, and typhoid also can occur in kava consumers. If you have taken kava and are having symptoms of liver damage, such as yellow skin, jaundice, fatigue, abdominal pain, loss of appetite, nausea, vomiting, joint pain, seek immediate medical attention. Do not take kava if you have medical conditions like depression, liver disease such as hepatitis or Parkinson's disease. Children and pregnant mothers or breastfeeding mothers should not take kava. Do not take kava if you are going to have surgery, and tell your surgeon if you have taken it in the past. Kava can prolong the effect of anesthesia. Do not drink alcohol while taking kava. Other side effects associated with kava include allergic skin reactions such as contact dermatitis, dizziness, drowsiness, restlessness, stomach upset, tremors. Long-term use at high doses can cause flaky, dry and yellowish discoloration of the skin, hair loss, partial loss of hearing, loss of appetite. Like alcohol, kava may have intoxicating effects and should not be taken before operating a car or other machinery. There are many possible medication-drug interactions with kava. Beware. Do not take kava unless you are under the supervision of a doctor, especially if you are being treated for disease. Do not take kava with prescription or over-the-counter medication. Kava may interact with the following. Anticonvulsants. Kava may increase the effect of medication such as phenytoin or dilantin that are used to treat seizures. Alcohol. Do not use kava and alcohol together. The risk of impairment and the risk of liver damage are greatly increased. Anti-anxiety agents and kava. Kava may increase the effects of CNS depression or brain depressants, such as benzodiazepines, used for sleep disturbance or anxiety, and barbiturates, which are used for sleep disorders and seizural activity, such as Valium, Ativan, Halcyon, Librium. Diuretics or water pills. These drugs get rid of the body's extra fluid. Kava can make the effects of these drugs stronger, raising the risk of dehydration. Phenothiazines or phenogin medications and kava. Kava may increase the risk of side effects associated with phenothiazine medication, often used in the treatment of schizophrenia, including chlorpromazine and promethazine, which are used as an antihistamine. Levodopa. This has been at least one report that shows kava may reduce the effectiveness of levodopa, a medication used to treat Parkinson's disease. You should not take kava if you are taking any medication containing levodopa or if you have Parkinson's disease. Medications metabolized by the liver, because kava works on the liver, it may affect medications that are metabolized in the liver. Speak to your doctor about any medication you are taking before taking kava. In concluding this series, I trust we all have benefited from the various episodes. As individuals and important members in our communities, we will be proactive with wellness and healthy lifestyles, viewing health and wellness in a new light. We must become proactive and practice what we have discussed in the last 13 episodes. We cannot deny that non-communicable diseases or NCDs are destroying our families with premature dying and death. Your health is in your hands. Eating healthy, exercising daily will take all of us into greater awareness of health and well-being in the future. Thank you to all the guests that have taken out time from their busy schedules to come help us spread the much needed information about health-related issues in Fiji and how to prevent and address and potentially mend these problems. If you have any queries on today's topic or any topic from this season, please like and drop us a note on Facebook, Bula Wellness, FBC TV, or write to us, bulawellness@fbc.com.fj. From myself and the crew here at FBC, thank you and have a blessed evening. Goodbye.